My name is Dr.Amelie. I'm a Codian, and today I'm going to be talking about the gynecological history for the NAC exam. Here is my outline. I'll be talking about the history of the present illness, associated symptoms, the gynecological history, the obstetric history, sexual history, post-medical history, family and social history. If you notice, I have highlighted LMP in red at the right hand corner. This is because very often we may forget to ask the LMP from a female patient, and I would just advise that at the beginning of your encounter with a female patient, you scribble LMP in the corner so that you don't forget to ask. So usually the history of the present illness, the symptom, the chief complaint, can range from bleeding to discharge to a missed period or the inability to conceive. Whatever the symptom may be, it's important to find out its onset, its course, and its duration. The onset refers to how the symptom started, whether it was a gradual onset or whether it was very sudden. The course refers to how the symptom has progressed. So is it getting worse? And then you want to find out if it's been there all the time, and has it been continuous, or has it been off and on or intermittent? The duration is important because if it's been just a few days, it would suggest an acute condition. But if it's been there for months, then it would suggest more a chronic condition. The associated symptoms can be regarded as being directly related to the chief complaint or being a symptom of a related system. So if we're thinking about symptoms related to the chief complaint, if we have bleeding, for example, related symptoms would be abdominal pain or swelling. If we had discharge as a chief complaint, related symptoms may be fever, dysuria, nausea, vomiting. And if the chief complaint was amenorrhea, the related symptoms may be breast tenderness, nausea, or vomiting. Speaking of related systems, the systems that are close by to the genital system are the urinary system and the gastrointestinal system. So symptoms related to the gastrointestinal system are diarrhea, nausea, vomiting, abdominal pain, or swelling. And those related to the urinary system include dysuria, frequency, or suprapubic pain. So these questions are important to ask because they help you to rule out your differential diagnosis. For the gynae history, we want to find out when her last period was because it may be the difference between detecting a pregnancy or not. The menstrual history includes asking how old she was when she started having periods, how long her periods last, how long her cycle is, whether she has heavy flow or a light flow, and if her periods are regular. We also want to find out if she's had any past gynecological procedures, which may include a D&C, may also include a laparoscopy, or even a cervical biopsy. We also want to find out if she's had any previous diagnosis, which may be fibroids, even it could be a cervical cancer, or it may be just polycystic ovaries. So in the obstetric history, we want to find out if she's ever been pregnant, if she's currently pregnant, how many previous pregnancies has she had, and what was the outcome of each of the previous pregnancies. Has she had abortions, miscarriages, term deliveries, preterm deliveries, or stillbirths? We also want to find out the route of delivery in each case, whether she had vaginal births or if she has had a cesarean section. So for the sexual history, we want to find out if she's sexually active, what her sexual orientation is, how many partners she has currently, and how many partners she's had in the last 12 months. We also want to know what kind of contraception she's currently using, and if she's ever been screened for a sexually transmitted infection or had a pap smear done in the past. The past medical history is similar to that taken from a male patient. We want to find out if she has chronic medical conditions or if she's ever had previous surgeries. In her family history, the things that are important are to find out if there are any gynae conditions that run in families, like fibroids, infertility, or even gynecological malignancies. Her social history would comprise of her smoking status, whether she drinks alcohol, whether she uses recreational drugs, and what kind of support system she has. The support system is important because in cases of domestic violence, you want to find out who she lives with, whether she feels safe at home, or whether the person is supportive of her. Finally, my additional tips include that we should always show empathy for our patients. We should make sure at all times that we have a patient-centered approach to taking a history, meaning that we have to pause and ask every so often for feedback. We ask, do you want me to repeat that, or do you have any questions for me? Active listening is very important because if we're not listening actively, we could miss a couple of vital points that the patient might be telling us. Time management is important because each case is time bound. We have to make sure that we finish our history early enough so we can move on to the examination or counseling. Above all, it's important to remain calm. And all I can say from here on is I wish you all the best in your NAC exam. Have a great day.